Every year, nearly 800,000 people in the United States have a stroke, and 3/4 of those are having a stroke for the first time. In this month's Brain Matters, we explore the causes, the symptoms, and how to treat it. Well, today we're joined by Dr. Krel and Dr. Noorie Pednekar with the Community Neurosciences Institute and Community Health Partners. Good morning to you both. Thank you guys for being here.
Good morning.
Okay, so let's just get the basic question out of the way for people who don't understand. What is stroke?
So stroke is really a broad term. It's used to define two main types of conditions. The first is what's called as an ischemic stroke, and it's the type of stroke that happens when an artery in the brain is blocked off, and it can cause a sudden onset of stroke-like symptoms, which is called as ischemic stroke, and it's the most common. And the second type is what's called as a hemorrhagic stroke, and it's when an artery bursts in the brain and can cause bleeding into the brain.
Wow, okay. So how often are either of you treating patients with stroke?
So, as you know, Community Regional is one of the busiest hospitals in the state, but it's also one of the biggest hospitals for the Central Valley. And so as a part of a growing neuroscience team, we predominantly work there. And I would say on an average, we see about 8,000 combined stroke and TIA patients annually. So I'd say that's a lot.
Wow.
And an integral part of what we do is provide emergent stroke care.
So for people who aren't aware, I know sometimes people just nonchalantly say, oh man, I think I'm having a stroke. What are the signs and symptoms? I know some of them can feel common.
Mm-hmm. I would say the easiest way for people to remember is the acronym BFAST, where B stands for balance disorders, E stands for eye or vision symptoms, and then F stands for like a weakness in the face, A is for arm or leg weakness, and S is for speech. And then I think T is really for emphasizing that time is of essence, and it's so important to come to the hospital as soon as possible.
I read about something called pre-stroke. Is that where you wrap up all the symptoms together before you actually have the stroke, or what is that?
So I think, pre-stroke is also what's like a TIA or a mini stroke, and essentially it's a transient onset of stroke-like symptoms, and they resolve within a few minutes, and so patients are not left with a permanent deficit or any permanent damage. But I want to emphasize that it is, like how chest pain can be sort of a sign of a heart attack, a TIA can be a sign of like a big stroke that's waiting to happen, so it's important to come to the hospital as soon as possible, even if you had TIA-like symptoms.
And that was going to be my next question, is how soon should you seek medical treatment, medical help?
Mm-hmm. Obviously, as soon as possible, right? Because we hear this often, time is brain, and that's because brain cells simply cannot survive without oxygen for prolonged periods of time. And treatment for stroke is time sensitive as well. So if we're only able to give the clot-busting medication within a certain specified amount of time.
Okay, so when is surgery necessary, Dr. Krel?
So that actually was a nice transition. The timing really defines what surgery options are available and when it's necessary. The first intervention is something that our interventional colleagues do, and they actually can retrieve large clots to cause blood flow to be restored to the brain and actually stop the stroke from happening. And that's, of course, the best case scenario in a stroke. The next option is a rescue surgery. The stroke has already happened, we're outside the window of intervention, and in that case we can do life-saving surgery to decompress the brain. The injury from stroke is twofold. There's the clot, and then there's also the swelling that happens because of the clot. Surgery doesn't do anything for the clot at that point, but it does treat the swelling. And then the last surgery is a restorative surgery. Once the stroke has already happened, the patient is outside the acute window, we can do surgeries that can help with certain functional syndromes after stroke, like pain, certain movement disorders like certain tremors and those sorts of things. So there are surgical options for stroke that are new and emerging.
Excellent. Is there a particular age where this is more common? I've heard of younger people having strokes lately, but it seems like it's more common with elderly patients. Does it matter?
So that may be a better question for Dr. Pednekar, but there are differences in how those stroke patients present.
Okay.
Yeah, I would say predominantly it's a disease associated with older age, but lately we've seen younger people having more strokes, and there have been trends specifically because of increased rates of hypertension and other stroke risk factors.
Okay, perfect. Really quickly though, we only have a few seconds left. Is there a way to prevent stroke at all, or is it just you have no control over it?
I think it's primary prevention, really just getting to your doctor. Hypertension is the #1 stroke risk factor. Studies have shown if you decrease, take good care of your blood pressure, the stroke risk can decrease by almost 40%. So talk to your primary care, get your risk factors under control.
Perfect. All right. Hopefully that shed a light for everybody out there curious about stroke. Dr. Krel, Dr. Pednekar, thank you so much for being here this morning and for your expertise. Now, if you have more questions about stroke, you need more clarity on it, just call the Community Neurosciences Institute at 559-22-BRAIN. We'll be right back.
This portion of the news is sponsored by HR Mobile Services, keeping